Our last speaker on this panel is Cathy Wusterbarth from Need Our Water Now, which is called Now. She's co-leader and founder of Now in Oscoda, Michigan. Now was created in 2017 to give Oscoda, Osable, and surrounding communities a voice. The mission of Now is to be a reliable resource and catalyst for education and communication, while advocating for long-term health and environmental welfare plans on behalf of those affected by the water contamination from the former Wusterbarth Air Force Base in Oscoda. Through her volunteer efforts, she and her group have consistently demanded the state of Michigan and the Air Force address the PFAS contamination that affects her community and now over 700 military installations. She was invited to the 2019 State of the Union address by Congressman Dan Kildee to represent communities affected by PFAS contamination and to support the newly created Congressional PFAS Task Force. She believes the federal government should conduct epidemiological studies necessary to correlate veteran and their families' health outcomes, in addition to testing and monitoring the health of Oscoda residents in relation to their PFAS exposure. Cathy is a registered dietitian nutritionist and is a native of Oscoda, where she currently lives and works. Welcome, Cathy.
Thank you, Dr. Brown, and thank you to the committee for hosting these town halls so that people from affected communities could submit their evidence regarding the human health effects of toxic PFAS chemicals. I am Cathy Wusterbarth, and I'm the co-leader of the Now Need Our Water Community Action Group. And I'm going to attempt to share my screen.
So if you should have access, so if you push the green button at the bottom, where it's the green arrow.
Yes.
And then you choose the window that you want to share.
Yes. All right.
Okay. There you go.
Thank you.
Okay. And now you want to put it in display mode.
Right. Oh, goodness.
Upper left is the display.
Share. Oh, goodness. It's the controls are covering my.
Also, yeah, the Zoom controls sometimes cover up what you want to see, and also it's down at the bottom where it looks like a projector screen. That little icon, in the bottom right.
Mm-hmm.
Yeah, I think you can click that too.
All right.
They give you like too many options, so it makes it sometimes
right.
confusing.
All right. Thank you so much for the assistance. So,
no problem.
I come to you from northeastern Michigan, where natural resources are abundant, but financial and academic resources are not. We are on the shores of Lake Huron and the Great Lakes, which comprises 20% of the world's fresh surface water. We are the home of the former Wusterbarth Air Force Base, which is the source of the toxic PFAS contamination in our community. The plume image you see is flowing from the base into the groundwater and nearby lakes and rivers. The U.S. Air Force knowingly used these chemicals and discharged them into the environment without caution or care. For decades, veterans, civilians, wildlife, and our environment have been exposed to PFAS without consent. This tainted groundwater was used as the drinking water source for the base and community until the early 1990s. Still today, we have people using their private wells with levels of PFAS we know are dangerous. Horrifically, these plumes were also intentionally pumped from the ground for decades and discharged into nearby creeks and rivers. These creeks and rivers flow into Lake Huron, and Lake Huron is the drinking water source for hundreds of thousands of people in Michigan. For my first piece of evidence, I'll be submitting to the committee the internet link to an award-winning documentary called No Defense, which will provide you graphic examples of what happens when exposed to toxic PFAS chemicals. Coincidentally, this documentary is being released worldwide to the public today. In this documentary, you will meet Mitchell Miner, born in Oscoda, Michigan. His family will be telling you about Mitchell's exposure in utero at Wusterbarth Air Force Base and the lifelong effects on him and their family. With his passing last year, they have dedicated their lives to ensuring Mitchell's memory and experiences help others avoid the adverse health effects of PFAS exposure. And this is James Bussey, and you'll recognize the person next to him, who served in the U.S. Air Force in Oscoda. He has been an outspoken advocate for veterans that were exposed and sadly is so ill today he cannot present to you. He has asked me to submit his medical records, including a long list of diseases and recommendations from his physicians on his exposure to PFAS, which was documented through blood testing. And this is Lowell Miner and his mother, Diana. He and his family ate the aerial wildlife for decades, which now have state of Michigan issued do not eat warnings due to their record-setting levels of PFAS. Lowell's mother, Diana, passed away from cancer just days after the filming of No Defense. Esteemed committee members, you're being asked to assess the strength of evidence for health effects suggested in human studies. The people I've just mentioned are real-life examples with real-world human exposure. Further, the data gap that exists can easily be explained by the lack of access to testing of our bodies to show the level of exposure of PFAS by polluters like the Department of Defense. Next, you state you want to develop general principles for clinical evaluation and reasons for testing. I will attempt to answer these for you. When to test? Now, establish a baseline as soon as possible, then annually thereafter, just like other risk factor measurements like cholesterol testing. Who to test? Well, I say all of us. PFAS is now everywhere, but most importantly, start in identified highly PFAS exposed communities like Oscoda. How to test? Simply through affordable, accessible labs like the one we just opened here in Oscoda. What to test? Test PFAS chemicals to the fullest extent. Consider processes that will measure all PFAS unless specifics are needed to point out the polluter liable for that exposure. And that brings me to, what are the risks of testing? The only risk is to the polluters that do not want us to link them to our exposure. And lastly, what are the related social and ethical implications of testing? In our communities, we are experiencing the degradation of trust with the very institutions we believe would protect us, such as the EPA, government, and the military. Ethically, healthcare providers have a responsibility to identify the factors related to the development of diseases in their patients. Without this guidance from the CDC, they are left to believe these chemicals have little or no effect on the human body or future generations. In review of the current knowledge of PFAS exposure sources, one need only look at the largest PFAS polluter in the world, the Department of Defense. In 2012, Wusterbarth Air Force Base in Oscoda was reported as the first military installation with PFAS pollution. Now they admit there are over 700 installations, and most certainly that number will grow. In Oscoda, the AFFF PFAS-laden foam is flowing through our groundwater, into our lakes and rivers, and in the bodies of humans and wildlife that depend on that water. We have toxic foam piling up on the shores of these bodies of water, reminding us of our exposure daily. You are asked to advise whether changes are needed to the current CDC guidance and recommendations on PFAS testing. This study is a result of the PFAS communities telling you changes are needed. We are here in these town halls to tell you why and explain what we need. In the state of Michigan, the Department of Health and Human Service is relying on this guidance document to educate our physicians. We've been told this effort will be undertaken since communities are desperate for reliable information on their newly discovered PFAS exposure statewide. Even here in Oscoda, having known about our exposure, I've provided the current 21-page document to my doctors who follow and treat my past cancer and immunological disease. They disregard links to my medical conditions and frankly state The document is just too lengthy to review. In our desperate efforts to learn how much PFAS is in our bodies, we have been fed crumbs of hope for exposure assessments and monitoring. Not surprisingly, this hasn't occurred, and still we wait, but with determination. Additionally, we've been passed over for inclusion in ATSDR health assessments and studies despite the clear appropriateness of determining exposure to veterans and civilians. I was reminded by a community member today, we've tested the fish, we've tested the deer, we've tested the groundwater, the waterways, and the foam. When are we going to test the people? It's really quite simple. First, we need to know how much PFAS is in our bodies. Second, we need to identify how it is getting into us. And lastly, we need to take steps to minimize that exposure. The damage to our cells is being done every moment of every day. Swift action must be taken by this committee and by the CDC to give us the tools to stop this madness. Thank you very much for giving me the opportunity to present our stories and the evidence of the health effects of PFAS from the perspective of Oscoda, Michigan.
Thank you very much, Cathy.